Hi, I'm Joshua and I'm from CUHK and I study medicine. And today we'll be talking about how we can improve elderly care in Hong Kong. Although many places in the world have an aging population, Hong Kong's major problem is that many elders choose to care about their health later down the line, when acute problems start emerging. Problems become so severe that patients go straight to specialist clinics and hospitals, and primary health services responsible for early preventive care are irrelevant. Much of the focus is on disease diagnosis and treatment rather than prevention. Therefore, a large burden is imposed on public hospitals, causing excessively long waiting times, an unbearable workload for healthcare workers, and most importantly, late intervention worsens the prognosis for patients. In this project, we want to promote preventive healthcare, which would encourage the elderly to start managing their health sooner, decreasing the risk of complications and relieving the pressure on secondary healthcare. We want to promote preventive healthcare through an app which we call Eldergether. First of all, Eldergether provides centralized reminders on screening and vaccination to its app users. At the moment, such reminders are scattered across various locations such as news announcements and advertisements. Therefore, the elderly may know about certain tests but not others. Eldergether gathers information from various sources such as the government and universities and makes this information accessible for elderly from anywhere across the city. Eldergether then allows these patients and users to register for these tests, and Eldergether also records the patient's age and medical history and recommends different types of screening and vaccinations specific to the needs of the patient. Second of all, Eldergether provides fun ways for the elderly to take an active role in managing their health. Eldergether includes and digitizes various fun games with proven health benefits. For example, crossword puzzles are there to improve memory and maintain sharp cognitive function. These games provide a platform for the elderly to compete and interact with the family in a game setting. It creates opportunities for them to play with the family, promoting family togetherness, which is a core value in Chinese culture. Third of all, Eldergether includes educational videos and articles about exercise, diet, etc., and also fun, simple digitized questionnaires so the elderly can screen themselves for various illnesses.
Fourthly, Eldergether allows users to record various body parameters such as blood pressure and blood glucose levels. It informs users of whether these parameters are within normal range. If not, it automatically advises the user to seek professional medical opinion as soon as possible. Furthermore, Eldergether also provides a platform for discussion where elderly can share information and provide emotional support. Verified doctors and other health professionals also contribute to discussions to provide clarifications and prevent confusions. Eldergether also features private messaging. It enhances user privacy. To prevent misuse of the forum, consultations, prescriptions, and diagnosis is not allowed. Users violating such rules will be banned. Our text-to-voice, voice recording, and text magnification functions also enhances communication and accommodates for those with visual and auditory impairments. Finally, to encourage the elderly to use our app, we propose a point system. Points can be earned by downloading our app, by encouraging others to do the same, or by using various functions on our app. Points can then be used to redeem various gifts. For example, free food and daily products could decrease users' financial expenditure. Free sports equipment could facilitate exercise at home, while free lessons on how to use Skype or FaceTime could enhance communication with family, thereby decreasing their sense of isolation even when family is not physically present. By providing useful reminders and information, in the long run, Eldergether can promote disease prevention. Eldergether integrates, improves, and organizes many features into an all-in-one package that targets preventative care. Through its fun and engaging features and gifts, Eldergether provides more opportunities for friends and families to interact. It decreases elderly isolation and promotes togetherness.
Our main challenge is that poor health is a taboo and immensely private topic amongst the elderly in Hong Kong. They tend to be more superstitious, as shown by tetraphobia, where the number 4 is considered bad luck as it sounds like the Chinese word for death. Strict gift-giving etiquette, where clocks should not be given, as sending a clock in Chinese sounds like sending you to the end of your life. and avoidance of words associated with bad luck, especially during Chinese New Year, such as poor, death, or broke. To better accommodate the needs of our target group, we present content and activities in a very optimistic fashion. Our points system serves as positive reinforcement by both rewarding and incentivizing health-improving activities. Eldergether's forum feature also allows elderly to not be ashamed of their own health condition, but instead to be more open and active in managing their health. Using an app as a tool to improve health amongst elderly in Hong Kong is a great idea as it makes use of existing resources and advantages. Currently, the majority of elderly in Hong Kong own a smartphone, and the percentage of smartphone ownership continues to increase annually. Internet access is also easy as both Wi-Fi and data speeds in Hong Kong are amongst the highest globally. In addition, Hong Kong also enjoys many free public Wi-Fi hotspots, which are located at every train station, every shopping mall, as well as public facilities such as libraries or sports complexes.
We have drafted a 5-year plan as shown, where we focus on app development, content development, beta testing, promotion, and evaluation each year respectively. For the first year, we will start to search for a suitable app development company and negotiate a contract. We will also recruit a manager to oversee the whole app development process. At the end of the year, the structure of the app will be built. For the second year, we will start to prepare and upload content including informative articles, quizzes, and videos. We will also invite healthcare professionals to join our app and also to verify the app content. For example, physical therapists could help reveal the exercise tips, and also occupational therapists could help to reveal our general lifestyle tips. For the third year, we will recruit IT supporting staff to help with our beta testing and also troubleshooting. We will also invite elderly home as well as open recruitment including NGOs to participate in our initial beta test. We plan to launch our app at the beginning of the fourth year. We will distribute advertising materials to doctors to let them to invite their patients to join, as well as advertise in newspaper and also social media. To further promote our app, we plan to collaborate with parties like NGOs and District Council. Another thing we need to do is to recruit corporate partners for donation of prizes. For example, companies can donate sample of their products and enjoy spaces for advertisement in our app in return. Finally, for the fifth year, we will launch survey and also to review our internal data to evaluate our app and also to find possible areas of improvement. The impact of our app could be measured by the number of active users, downloading amount, and also the rating of our app in Play Stores and App Stores. We could also invite elderly to fill in surveys to tell us about their user experience and also what could be done to improve the app. Bonus points could be given to them as an incentive, so it is expected that a great amount of response will be received.
As for our budget plan, we have a total of $2 million covering the cost of these items. A core team with different specialties are needed. The salaries are estimated based on the average income of that field of work in Hong Kong. Healthcare professionals will be recruited for giving advice, and consultation fee will be paid. A total of $692,000 is consumed in this area. Our team will cooperate with an app developing company. $600,000 is needed to develop this app and cover possible upgradings in the first few years. We will launch the app to the two major platforms, Apple App Store and Google Play Store. Around $200 is needed. Promotion is the key to the success of our app. 4 major areas we focused: brochure printing, newspaper advertisement, advertisement on the public transport, and online advertisement. Around $267,000 is needed for a comprehensive promotion. Some of the budget should be reserved for logistics, legal, and other costs. For example, warehouses might be rented for the storage of gifts. It's estimated that a total of $40,000 is required. Lastly, we will put 20% of the initial budget, accounting for $400,000 for contingency reserve. This ensures our plan to be feasible for implementation.
Eldergether is a combination of the words elder and together. We want to emphasize that health and happiness can be achieved when everyone works hand in hand, supporting one another. Elder health is not just a government policy. It is something we can all play a part in.